Let's get started. Welcome, everyone. I wanted to welcome everyone to the webinar. For those of you who don't know who I am, my name is Dr. Lauren Levine. I host and moderate these webinars and have been doing that for probably around 10 years now. As always, because we have great speakers, we get a great turnout. We had over 600 people registered. I hope that everyone's staying safe and healthy out there. And as usual, I commend you for continuing your dental education. Of course, you know, the need never ends, and that's why we do this on a pretty regular basis. I'm only going to speak for a couple of minutes here, do some housekeeping. I want to make sure that Dr. Madrigal can speak for as long as he needs. We also want to leave time at the end for questions. I know many of you have been on my webinars in the past. You kind of know the format. The speaker will usually talk for 45 to 55 minutes, give or take, and then we want to take questions afterwards. With this many people registered, we obviously can't do phone verbal questions. So on your screen, you have a good webinar control panel. Go ahead and type in the questions as you think about them. At the end, I never know how many questions we're going to get. Sometimes we get 5, sometimes we get 105. I'll do my best to get to every question that we can. We also want to be respectful of people's time. We're not going to be on here for 2 or 3 hours. I mean, we have a hard stop at 90 minutes, but usually we end before that. So. But just type in your questions and we'll do our best to get to all of them by the end of the webinar. In the next few days, look for a couple of things. First off, I record the webinar as I do all my webinars. You'll get a link to download the recording, so no problem if you can't stay to the end or you have something else you need to do before the end. You will be able to watch this at your convenience. During the webinar, Dr. Madrigal is going to show some of the products and systems that he uses, which are exclusive to TDSC. I want to thank them, as always, for their sponsorship of these webinars. They're the ones that bring in these amazing speakers. They're the ones that develop the ideas for what we're going to talk about. And they also handle the CE for the webinar. I get a ton of questions after the webinar and sometimes during the webinar about CE. I'll try to repeat it at least a few times, just because I know some people are probably still not logged in yet. But here's the way it works. Within an hour of the webinar ending, you will be sent an email. And in that email will be a link to a very short survey. I think it says 3 or 4 minutes. It probably takes more like 30 or 40 seconds. It's really quick. Once you do that, that information gets forwarded to TDSC, and then the CE gets sent out. With this many people, with 600 people that are registered, it still can take a while. It's not unusual for it to take 6-7 days, sometimes a little bit faster than that. For reasons that aren't quite clear to me, a lot of times those CE emails end up in people's spam folders. So, every day or two, just check your junk folder, see if it's there. If you don't have it by next Wednesday, say, then you can email me and I'll be more than happy to follow up with them to make sure that they got sent out. And sometimes, like I said, you don't know what happened to it, but we'll make sure that it gets sent to you as long as you've earned it. Now, when I say when you've earned it, that means you have to be on for the bulk of the webinar. You can't pop on for the first 6 minutes and then leave or show up half past the hour. I mean, it's just AGD PACE does not allow people to get CE under those circumstances. But as long as you're here for, I think it's like 70, 80%, some number like that. But as long as you're here, you will be sent that CE form. But like I said, it can take up to a week or so. With that out of the way, I am thrilled, as always, to welcome Dr. Madrigal back. He has lectured for us many times in the past. We always get a great turnout for his webinars. He's a general dentist who has practices here in California and in Mexico. He graduated with honors from the University of Sal School of Dentistry in León, Guanajuato, in Mexico, where he got his DDS. Since then, he's become a member of the faculty of the American Academy of Implant Dentistry, as well as the AAID Maxi course in Asia. He's a member of the American Academy of Cosmetic Dentistry, the California Dental Association, and the Stanislaus Dental Society, which I have actually lectured at a few times. He is an internationally recognized speaker. If you're in dentistry, I'm sure you know who he is because he's out there a lot. He is writing and presenting on just a wide range of topics like implant dentistry and clinical photography and minimally invasive veneers. And he's given these lectures here in the U.S., in Mexico, and Abu Dhabi, India, Brazil, all over the place. With a focus on cosmetic and minimally invasive dentistry, he believes that paying attention to the details is really what separates good and great cases. So Dr. Madrigal, we are thrilled to have you back as always and looking forward to the presentation this evening.
Thank you, Dr. Levine, and thank you all of you for joining us today. So this is going to be the final part, unfortunately, of the 3-part laser webinar series that we have been doing. So for those of you who have watched the other 2 parts, well, this is going to be the last one. If you haven't watched those other 2 webinars that we did before, I believe maybe Dr. Levine has the links for those. He can send them to you if you just shoot him an email later on after the webinar is over. So the first webinar that we did of this 3-part series was the just basics of laser dentistry. That was it. The second one was lasers used for periodontal treatment, and especially we talked a little bit about Restore gel, which is that hydrogen peroxide gel that will help us, just maintain a daily defense of our gums. And finally, today we are going to be talking about lasers in restorative dentistry. So this is really exciting for me because most of us here are probably restorative dentists. So we always have, those problems with either bleeding gums or especially those class 2 interproximal deep margins that just have decay, and we're thinking whether we send it to get a crown lengthening procedure or if we can do the crown right there or a filling right there. So really we have the technology now where we can usually restore about 90 to 95% of these cases without having to resort to surgery, to having crown lengthening, or to refer out of our office. We can actually use lasers now in a very simple way, which I'm going to show you, in order for us to actually accomplish long-term successful cases. So with that out of the way, I want to give you my contact information. Feel free to either shoot me a message through Instagram or send me an email, and I'll try to respond to whatever questions you may have. Obviously, the goal is going to be that we answer as many questions as possible during this webinar, during this hour that we're going to have together. But there's always a few questions here and there that we were not able to get to, or maybe we have a specific case that you want to go over. I would be happy to help you with that. So either send me again a message through Instagram or shoot me an email, and let's go ahead and get started. So the objectives for this lecture, they're going to be for us to recognize and explain the relationships between periodontal soft tissue management, especially when we're using them in restorative dentistry, because we're talking about comprehensive care. So we want to understand how we can use lasers for restorative dentistry. We also want to master the principles and the techniques of using resin modified glass ionomer. So the great thing about these glass ionomers is that they're extremely biocompatible. That means that if we're using them for, let's say, class 5 restorations or even subgingival restorations, they're going to have really great long-term success because the gums, the gingiva just hugs it. They just love it. So they don't get inflamed, they don't get irritated. And actually, we have this clinical attachment of soft tissue to this gel restore, to this resin modified glass ionomer. So I'm going to show you a few examples of those and really how many different techniques can be used in how many different situations we can use them, whether they're for restorative, for cementation. We just have a lot of different clinical cases that I'm going to be showing you to show you how we can apply them. And then finally, we want to just have the knowledge and the skills for both combined periodontal and restorative treatments. This means that we're going to be talking about a comprehensive assessment on how to choose the materials. When do you choose a regular composite? When do you choose ceramic? When do you choose a glass ionomer? So we're going to go over those different scenarios, and obviously having different case examples so that you can see the difference of each situation and when we use one and when we can use the other one. And then finally, we want to address the common challenges and the complications that we deal with every day when we're talking about that relationship between the periodontal tissue and all these restorative procedures that we're doing. We want to make sure that we're respecting that biological space, that biological width, that we're not invading space with materials that cannot invade space. That means that if you have decay that goes maybe all the way down to the bone or really close to the bone, if you do a crown there, sometimes the body will react nicely to it. Sometimes it'll be okay, and you'll be able to just, cement that crown and not have much of a problem. But more often than not, what happens is that, that tissue sees that violation of that biological space, and we get inflammation, we get some bone loss, or we can even get some restorative failure. So we want to avoid all that, and in order to do that, we want to make sure that we're recognizing and respecting this periodontal complex. So what is this periodontal complex? Well, we have the periodontium right here. We have soft tissue and we have hard tissue. The hard tissue is going to be the bone and also the tooth structure, but it's all interconnected, and we know that it's interconnected through this periodontal ligament. So we want to respect that cementum that helps us attach the tooth to that bone. But we all know this. This is just going to be the basics. But the important for this is that the periodontal tissue is not just the gingiva that we see surrounding the tooth. It's everything else. It's the alveolar bone, it's a cementum, it's these ligaments, it's all the supporting structures that hold these teeth in place. And if we understand their role in their overall health, we're going to be able to restore them in the right manner in order for us to not damage anything further, in order for us to not have any more bone loss, in order for us to actually have a stable tooth, because it's going to be held by all this different complex. So that is the importance of soft tissue management. The importance is that we want to make sure that we maintain a healthy soft tissue, because it's going to be essential for stable teeth. If we don't have a right foundation, then it's going to collapse. No matter how great our restorative work is, we can do beautiful veneers like we have in this case. These are all lumineers that we did in the front, but the important thing right here as dentists is to take a look at the foundation where our restorative work is going to sit. So we see right here that this gingiva is nice and healthy. We don't have bleeding gums. We don't have any redness. We don't have any swelling. So that tells us that in the long term, these veneers, they're going to look great. Why? Because the foundation is there. We have a stable foundation. It's just like building a house. A house that's built on a strong foundation is going to last many years. So it's the same effect that we have right here. So soft tissue is actually going to impact either negatively or positively, depending on how healthy it is. If we have soft tissue that is not healthy, the aesthetic outcomes, they're just not going to be the same. So we want to ensure that we have healthy soft tissues in order to just prevent any chronic systemic inflammation, that we prevent any aesthetic failures, and overall that we just maintain that patient stable throughout their lifetime. So like we said, a strong foundation is going to be long-lasting results, and that is what you want. The gums are actually that gingiva and the teeth together is what forms that aesthetic smile. So we have to have a harmonious flow between pink and white. So that pink and white aesthetics has to always be there. If we take a look at this case, we see in the bottom, that's the pre-op on the lower right. We see how, yeah, the gingiva looks like it's flowing nicely. Maybe it needs a little bit of contouring, which is what we did. We took the laser and we did a little bit of contouring here and there, but nothing too drastic. But we can see how on the top, when we did this try-in with these veneers, we see that everything is more harmonious. Everything is more balanced, a little bit more symmetrical. And a lot of it has to do actually with that just small contouring that we did for those on that gingiva, because a well-contoured gum is going to give us a more attractive and harmonious appearance. If we have diseased or irregular gum tissue, that's going to detract just from the overall aesthetics of the smile. So we want to ensure that we don't just look at teeth, that we don't just look at the white aesthetics. You know, a smile is going to be composed of that pink and white aesthetics. And we have many different issues that we have and that are very common whenever we're talking about the soft tissue. So what are these common problems that we run into? You know, what common soft tissue issues do we find in our office? Well, the first one is going to be gingivitis or periodontitis, right? So if we have red, inflamed, bleeding gums, or if we have a lot of bone loss or recession, or even black triangles where we have these spaces in between the teeth, like you see these lower teeth down here, you know, we have these black triangles, and it just makes the patient smile look a lot older. Makes it look unhealthy, even though this patient looks like he's getting a pretty stable now. You know, in the past they had this severe chronic infection that caused all this bone loss, and unfortunately we know that we can't get this bone back. So in order for us to continue to always have this harmonious look and having stable teeth, we want to make sure that we always pay attention to this foundation. And we communicate this with the patient. We let the patient know how important this foundation is, because if they're not taking care of their gingiva, they're not taking care of their gums at home, you know, there's only so much that we can do. So these problems are very, very common. Again, the most common one is going to be due to this chronic inflammation that we have. So we must educate our patients on this chronic inflammation. Let them know how we can get it under control. In the last webinar, we spoke about how we can use lasers in order to get an assistance to decrease this bacterial count, this enormous just ravaging disease that's going on in all the mouth, and how we can use, you know, whether it's antibiotics with irrigation, whether we're using chlorhexidine rinses, and even this laser dentistry or peri-restore gels. You know, we use this technology that we have available now in order for our patients to have longer lasting aesthetic results. So I'm going to give just a little really quick overview of the basics of dental lasers and how we can use them. So, you know, lasers have been around for quite a bit, and all it is really just going to be a focused light energy source. It's going to be focused on this tip of this tip of the laser right here. So when we get all this light that gets amplified and it gets distributed and focused on this central spot, what ends up happening is that we have a thermal change. So this thermal change is going to increase the temperature, and when we touch soft tissue, we're able to actually vaporize it, which is what we want. We want to be very, very precise in this, which is why the energy is focused on just one little spot. You know, the difference between a dental laser, a diode dental laser, like we see right here, and let's say an electrosurge, is that the lasers are extremely precise. That means that we can be precise up to 1, 3, 5 cell layers thick, and that's it. When we're talking about an electrosurge, you know, that is just going to take a lot of heat, a lot of energy. It is just going to kill everything that's in the way. So it's going to be a lot more harmful, and the process is obviously not going to be as precise as when we're using dental lasers. So we can use them for various applications in dentistry, whether it's soft tissue or hard tissue. The ones we're going to be talking about today are these diode lasers. These diode lasers, they are only for soft tissue. So they're not going to cut soft tissue. You don't have to worry about it damaging your tooth whenever you're doing a gingivectomy. You don't have to worry about cutting any bone with it. Why? Because they're so precise, and you can only focus them on this soft tissue without damaging anything else. So that makes it great for, let's say, any other situation, whether you're talking about tooth uncover, where you're talking about maybe implant recovery, whatever it is you're talking about. Whenever we're talking about just removing a little bit of precise soft tissue, you know, dental lasers are going to be the way to go. Okay, so we can also use them in periodontal therapy, like we spoke last time, and they're going to play a crucial role because they're so precise and because they're so minimally invasive. So they're going to provide us the ability to target and remove diseased tissue while preserving healthy tissue. So how does this happen? All right, well, first we have to know the different morphology of diseased tissue and healthy tissue. You know, when we're talking about diseased tissue, they have all these different pathogens. They usually have a little bit of necrosis, so they tend to be darker. As opposed to healthy pink tissue, you know, the laser energy is going to have a stronger affinity for dark pigmentation. What that means is that when you're putting this laser tip down into a sulcus around the tooth, if there is any diseased tissue, most of that laser energy is going to be attracted to this dark pigmentation. So that means that it is very precise, but it also targets this tissue, which is great, you know, because that is what we want to use it for when we're talking about dentistry. They're also going to aid in the reduction of bacteria and promote faster healing. So that promotion of faster healing comes because of two things. First, we're getting off, we're getting rid of all this irritation, right? We're getting rid of this agent that's causing this chronic inflammation, which is going to be the bacteria. But there's also a special effect that diode lasers have, and that is called you know, when we're using a low level energy diode laser, like this one that we see right here, the ones that are used in dentistry, we have something called biostimulation. So biostimulation, what it does is that it's actually going to stimulate those fibroblasts that produce collagen, that produce connective tissue. It's going to actually make them proliferate, and it's going to produce more soft tissue, produce more collagen a lot faster. So that is going to promote this faster healing. So that is why they're great. And the last part of why healing is so much faster when we're using lasers is because they're so precise. We're only removing 3 to 5 cell layers thick, and that's it. So that means that the healing process, it's so much faster, especially when we're talking about, let's say, frenectomies. When we're doing a frenectomy, we don't need to do sutures because everything is cauterized, there's no bleeding, and within a week, you know, that patient's going to be ready to go, you know, as opposed to having to come back in a week to remove sutures. In a week, you know, usually the patients come back after they get their frenectomies with the laser and everything's healed. Why? Because it promotes faster healing. And just overall, you know, dental lasers, they're just going to enhance the efficacy and patient comfort in periodontal care, which is why we use them. So there's a myriad of different procedures that we can use them for in dentistry. I have a table right here of just different codes that we do, or different procedures that we can use the laser for. So we can use them for gingivectomies, whether they're periodontal or restorative. Frenectomies are huge, whether the labial frenectomies or lingual frenectomies, you know, cuspid exposure or third molar exposure. We can even use them for some biopsies, or whenever just destroying a lesion or aphthous ulcers. And again, like we spoke last time about laser bacterial reduction, when we're talking about a laser assisted SRPs, you know, we can use it for that. And then finally, we can use them also to desensitize. So whenever we have a tooth that's extremely sensitive to either hot and cold, it's really simple for us to, you know, just do a small prophy, clean those roots off, put a little bit of fluoride, and then use our laser on that fluoride on the tooth to occlude those dentinal tubules. So that is going to seal off those dentinal tubules for about a year, sometimes 2 years, you know, and that patient's sensitivity is going to be gone instantly. So we can use them for all these different procedures. And the reason why we can use them for this, again, is because we have all this technology that makes it so portable now, so easy for us. So the different lasers that we use in dentistry can vary. You know, we can talk about diode lasers, CO2 lasers, erbium lasers, or the YAG lasers. And each one of these is going to be a little bit different. So the use is going to be different on all of them. So the first one is going to be the diode lasers, and those are the ones that I have in my offices. We just use diode lasers. because we can use them efficiently for soft tissue procedures like gingival contouring, but we can also use them for periodontal procedures. So in each one of our hygiene rooms, we have a laser because they're used all day, every single day. Why? Because we know how beneficial they are in removing this diseased tissue and making sure that we try to sterilize as much as possible those sulcuses, those gingival sulcuses, and we also are going to promote faster healing with that biostimulation that we spoke about. We can also use CO2 lasers, which are ideal for cutting and vaporizing soft tissue. Now, these are mainly used like in oral surgeries. There's minimal tissue damage, again, because they're very precise. We can use erbium lasers, and they can be used for both soft tissue and hard tissue. They can be used in cavity preps. These are usually a bit more bulky and more expensive. And the same thing for the YAG lasers is that they're sometimes more expensive and a lot bulkier. So when we're talking about dental procedures, 95% of the procedures are going to be done with diode lasers, and they're going to be more effective than all these other different procedures, than all these other lasers. And the great thing is that they are usually the most affordable out of the 4 categories. Okay, so next, we got done with really explaining how lasers work, but what really are the advantages for these procedures? So why use a laser instead of something else? Well, we can use them for a lot of different procedures that we saw, but the most important one for me is probably going to be that they're so precise. They're extremely precise, so we're only cutting the tissue that needs to be cut. They help tremendously when we're talking about hemostasis. So if we have bleeding, they're great for that because they can provide effective hemostasis, which is the bleeding control, and it's going to reduce the need for us to use sutures when we're talking about, let's say, a lesion removal or a fibroma removal, or when we're talking about frenectomy. Not only that, but we can also use the hemostasis when we're talking about taking an impression or a scan after we do a crown prep. So I know this happens to you because it happens to me all the time when we have that either distal or mesial, that interproximal deep box that goes all the way down to the gingiva. And we're done with our crown prep, we're ready to take impression, but we're trying to pack cord and there's just blood everywhere. So sometimes, we use viscostat or some hemostatic agent in order to help control the bleeding, but it's usually not that easy. When we use the lasers, we can actually coagulate everything, cauterize those nerve endings too to avoid any post-op discomfort, and we are ready to take that impression then and there, or our scan then and there. If we're taking impressions, we don't have to pack cord. So what happens if you're packing cord, but it's bleeding, and then you take an impression and you look at the impression and it's not right? You have to redo it. 90% of the time that cord comes right with that impression. It comes right out. And you have to pack cord again, but of course, everything is bleeding again. So it just makes a mess all over again. And then you already lost a lot of chair time. So with the laser, super easy. Just do some laser troughing around that tooth and you are ready to go. Take an impression. If it doesn't work out, take another impression, but the tissue is already retracted. You don't have to worry about that. You don't have to worry about any bleeding. So there's going to be less discomfort, reduced swelling, minimal tissue damage. They're compact and portable. That is probably one of the best benefits of this laser, is that it's the size of a Sharpie. So we can use it from room to room without any problem. So the one that I have is wireless, which is the one that you saw in that picture. It's a wireless laser. So we can use it from room to room without any problem. And it's just extremely easy to carry and do different procedures because all you need is just that foot pedal, which is also wireless, and the laser, which again, it's the size of a Sharpie. So it is extremely comfortable for the clinician to use, but it's also extremely comfortable for the patient because you usually need a lot less anesthetic. If any, sometimes we just use a little bit of topical anesthetic and that's it. We also have this wavelength precision, which is going to be important when we're talking about using it for periodontal therapy. So it is actually set at 808 nanometers, which is the ideal wavelength for periodontal treatment. And overall, we're just going to have enhanced soft tissue management. Okay, so we got that out of the way. Let's talk about now cases. So real life cases, like how can we really use this? Like this is real life. This is what I use in my clinic every day. I'm going to show you these types of cases. So we have laser plus restorative cases. When we're talking about these studies, we're going to use different types of cases. Okay, so the first one we're going to go over is going to be using Geristor, which is that glass ionomer, and it's going to be used for class 5s. We're also going to talk about Geristor in class 2s. We're going to talk about deep margin elevations and crown preps and deep margin elevations. So I try to pick starting from the simple cases that we have in our office all the way to maybe the more complex things that we can see, just so we get an overview of how versatile these lasers and this restorative material is. Okay, so let's start with explaining what this dual cure resin ionomer is. So this is Geristor. Again, it is dual cure, but the great thing about this is that it's extremely biocompatible. So it is so biocompatible that you can actually use it for subgingival restorations, and it is going to perform wonderfully. So it is a great material because it is just so biocompatible. The soft tissue will actually even attach to it. So it is great to be used when you're talking about class 5 restorations. So we're going to use it whenever we have some deep class 5 restorations. Maybe sometimes when we can't do proper isolation, with a rubber dam, and even for pediatric dentistry, it's great. So what is it? Again, it's a dual cure resin reinforced glass ionomer. So it's flowable and it's really easy to apply. So let's start seeing the first case. So first case, we have all seen these cases and we see them every single day, whether it's with the fractions with decay or just a fractions without decay, but we see this every single day. So we have these class 5 lesions that we need to restore. First thing that we do, pretty straightforward. These were not subgingival, so we just removed the decay, we cleaned it out. After we cleaned everything out, we have no more decay. We know we have a good bonding structure now. We just place our etch. So we're gonna etch for 30 seconds. And after we're done etching, we are going to place our Geristor, polish it, and then finally we are going to cure it. Okay, so this is what it's going to look like after after we put the Geristor and it's polished, and this is going to be the final cure. So we put a little bit of a gloss in there to cure it, and we are ready to go. So this is really going to be a great way to do these class 5 composites, because a lot of times what happens is that we have these cases, we see these cases, we either prescribe a night guard and that's it, and then we just don't touch them. When we don't touch them, because sometimes we place composite in there and it just falls off, place it again, it falls off again. So Geristor, it is great because the bonding is going to be so much easier. It's not going to be dependent on it being completely dry. Why? Because again, it's a glass ionomer, so it actually has a little bit of hydrophilicity. Okay, so that's a pretty simple case that we have, but let's see something that's a little bit more complex. Now we have a class 5 with the laser. So this is just an overview of what the laser is. We spoke a little bit about what type of materials do we use, right? So when are we going to use Geristor? When are we going to use composite? Well, if you can isolate, you can use composite, no problem. So in this case, we have this deep carious lesion, right? So it's really deep, it's subgingival. You know, if we're trying to retract that, then there's no way, because we have so much tissue that's just it's just too subgingival. So what are we going to do right here? Very simple. We take our laser, we remove a little bit of that soft tissue. We make sure that all of our lesion is exposed, and we are now able to see the margins where that decay ends. So when I see a case like this, now I say like, well, you know what? I can actually place a rubber dam right here. It's not necessary, but I decided to go ahead and do it in this case. We removed all that decayed tissue and we just restored it with some composite. So this is what that case looks like immediately after restoration. So it's completely restored now. It's gonna be able to heal a lot faster because we use that laser. We're not removing any of that extra tissue. So there's gonna be a short video. It's only 1 minute long. I do want to play it for us just so we see what it actually looks like. So this is going to be the case, and the first thing we do is that we're going to initiate our laser. After we initiate it, then we are ready to start trimming. And I know there's going to be maybe a little bit of lag because of the connections since we're live streaming. So we're going to remove a little bit of this soft tissue. And now I want you to notice how exact, how precise this laser is. So it is extremely precise because again, it's only removing from 3 to 5 cell layers, and that's it. Also, when we are removing soft tissue, especially in the anterior zone, we don't want to go too deep. So we just want to remove a little bit. We want to always be parallel to that axis of the tooth. So we want to be parallel to the axis of the tooth. In very few cases will you be going horizontally. The reason for this is because we just want to cause a little bit of tooth separation. So we want to separate that soft tissue from the hard tissue, and that is it. We don't want to do like, we're not really trying to go for a gingivectomy in this case. And another little trick here is that when you are doing gingivectomies, we're not wiping off the laser tip with alcohol and the 2x2. If you can see right there in that little opening, that little notch that the suction has, what I'm actually doing is I'm actually just wiping it off right there, and that's it. So we have our laser removal completed. I'm just taking a little bit of hydrogen peroxide right here just to clean off that excess soft tissue, and it's also going to help it heal a lot faster. So we remove this excess tissue, and after that, now our tooth is ready to be restored. So again, super easy to do, and this is the final result that we have. So we can see the before, the after, the same day. You know, that tissue is going to heal extremely fast. You see that there's no bleeding. Why? Because we are being minimally invasive, and that is what we want to do. Okay, so now let's go on and talk about these class 2s with the laser and add a deep margin elevation. All right, how does this work? Well, when we have a case like this, so this tooth needed a root canal, but we remove the decay and we see that we have all this soft tissue just embedding right there. We notice that we don't have access to get to the margin line that we have. So what are we going to do? We're going to take our laser and we initiate that tip. So that's why you see that it's a little bit dark. And now we're just going to trim away a little bit of that bone that we have right there. I'm sorry, not that bone, that soft tissue that we have right there, all the way down to that margin, to that healthy tissue that we have. So what do we have now? We have this right here. Now we are ready to isolate. We are ready to put a rubber dam on. We see all the way down to that margin. We know that there's no more decayed tissue, and we are now able to restore this. So after we did this root canal, we are now able to place our margin, our wedge and our band, our matrix, and we just fill it up with Jerry-Store. So we are using Jerry-Store not only to restore that class 2, raising that margin if we decide to do a crown prep later on that tooth, but we're also using it as a buildup and restorative final material. So the great thing about this, again, is since it's a reinforced glass ionomer, it's going to be great for restorative. It's going to be great for using it as a buildup, and it's going to be great also for deep margin elevations. But let's say now we did want to do a crown prep. Let's say we did want to do a crown prep. How would we actually finish this crown? What would this final restoration look like? Well, let's look at this last case. So this last case is going to be crown prep, laser, and deep margin elevation. What does it look like? We have this, our favorite type of cases that we have, right? Whenever we have this distal or interproximal, that upper molar, all this decay that sometimes goes all the way down to the bone, like what do we do? Because right now we see on the x-ray, it can go from here to here, right? But in real life, when we remove this, we don't know how deep that's going to go. So what do we do? All right, first thing, we're going to be removing that crown, and we're going to see how deep that tissue is actually infected. We have it right here. So everything looks fine. We have this crown prep that looked good, but we know that the decay is going to be under here, right? So under this crown is where we have that problem. All right, so we remove the decay, and what do we have? Well, we have about 3 to 4 millimeters, maybe 3 millimeters of subgingival decay. What do we do in that case? Do we go and do a crown lengthening and risk maybe having a little bit of involvement right there? Or do we actually use the technology that we have right now? Well, we have the laser. We know that it's extremely precise. So we are able to just trim away enough soft tissue to get us to this level. So now we see clearly our margin right here. Our margin is extremely clear. We know, we can feel confident that we can restore that. So obviously, when we do our crown, we might not feel comfortable placing our crown all the way subgingival like that. So what do? We look for a material that's biocompatible, that's going to be able to restore and lift or raise or elevate that margin. So this is why we call it deep margin elevation. Why? Because we have a really deep margin right here, but we want to raise it up. So how do we do this? In this case, we placed our rubber dam. We sealed off everything, everything from our restoration. We placed our bands, we placed our wedge, and we just fill it up with JerryStor now. You can see right here, there might be like a little bit of a gap. So we just took our instrument, we took a little spatula, pressed it all the way down there in order for us to make sure that there's no gap between that tooth and that tooth and the tissue. So we close it off, we etch, we bond, we fill it with JerryStor, and we are now ready to go. What is this gonna look like? Looks like this. This is beautiful, right? So we have this perfect margin now, perfect buildup that we did. Not only that, since JerryStor has fluoride, it's actually gonna be very noble to the tooth, right? So we are now able to prep our crown right here. Now you can see that all this margin is completely raised. So our crown is gonna sit on enamel, on the outer enamel, all over here, but it will actually sit on a restoration right here. And what does this mean for all the tissue that's in the bottom? Well, it's gonna love this JerryStor. And since it's gonna love it so much, it's so biocompatible that it is not gonna have a single problem with it actually bulking, like getting right back up there and closing that interdental space, interproximal space. We ended up placing an implant right here and a crown instead of this old bridge that we had right here. So what does this look like later on? This is what it looked like when we were seeing the final restorative process. We see all this right here is JerryStor. This is a 2-year follow-up, and we see that we have the nerve is still nice and well. There's no need for that root canal, even though it was really deep. But we see that the margin is actually sitting over here on tooth, but then right here it's elevated. So this is going to be JerryStor, and this is our crown. And the procedure, it's a success. Why is it a success? Because we know how to pick our materials. Whenever we're talking about something that we want it to be extremely biocompatible, Jerry Store is going to be the way to go. Okay, so that was that case. Finally, I'm going to give you a bonus challenge. So this is a case that came in 2019, I believe. So 2019, but the patient just came in last week. So I told the girls to take an X-ray and show me what it actually looked like right now. All right, so this is going to be laser and the Jerry Store re-cementation. So a patient walks into my office with this problem. So he had a bridge that's going to be in two different spots. So we have a little bit of a groove right here. So this crown and this pontic sat on the tooth and on this rest right here. All right, so it was a two-piece bridge. Unfortunately, we have this huge decay that was underneath the crown that he had. And when he came here, he came because the crown was loose. So the crown fell and we saw this. Like, whoa, you know what? This is actually going for extraction. Why? Because it's so deep. If you take a look at the X-ray right here, it's underneath the bone. If we do a crown lengthening, you're gonna have a furcation involvement right here, and that's just not going to be good. So what do we do? Well, the patient didn't have the finances to afford removing this and placing an implant right here and an implant right here. So what else can we do? How can we help this patient out? Well, what we did was we used our laser. We removed all that soft tissue that we had right here. And I know you're thinking, well, what about the keratinized tissue? We still have enough keratinized tissue left right here. We had about 3 millimeters left of keratinized tissue. But the problem is that the alternative to this was extraction. All right. So what do? We use the technology that we have. We do laser contouring right here, remove all that tissue in order for us to get access to the decay. We remove all the decay. Miraculously, this did not have any communication with the pulp. So since we didn't have any communication, we said, all right, it's really, really close. Judging by this X-ray, this should be going out, and if anything, maybe a root canal. But we were close enough. So what material can we use for restorative, but at the same time, we don't want to mess with this margin because we want to re-cement that crown? Well, we use Jerry Store. So we put Jerry Store on the crown. We built this up with Jerry Store. We restored with Jerry Store, and then we re-cemented his bridge. And this is what it looked like right immediately after cementation. So we have the bridge re-cemented, and we see that we have the Jerry Store right there. We took our burr and we just polished the edges, and we are now good to go. So this tissue is now healthy. It's now adapting to the Jerry Store. Not only that, but take a look at it. This was last week. So this is what it looks like. What is it? For almost 5 years later, this is what that restoration looks like, where it was a case that was due for extraction, and we're actually able to save it like this. So it just shows you how many different things can be done when we're using the right materials, when we're using the right technology, but especially when we're using the right combination. All right, so with that, I just want to end. I want to thank everyone again for joining us. We do have a few minutes for some questions. Again, feel free to either send me an email or a message through Instagram. I'll be more than happy to talk to you guys. And with that, I'll leave you with Dr. Levine. Dr.
Sorry
Levine?
about that. Were you? Yeah, I'm here. Did you? Yeah, there we go. There's the specials. I wanted to go over that first. Actually, the first thing I want to mention is that, and I talked about this at the beginning. I know some of you may have logged in a few minutes late. The webinar was recorded, as they always are. That will be sent out sometime in the next day or so. Actually, a few days for them to get out. As far as the CE goes, you have to have been here for the bulk of the webinar. You have to have been watching it live. Obviously, we have no way of tracking if someone watches the recording. But in order to get the CE, you will get an email within about an hour. And in that email will be a link to take a quick survey. It shouldn't take you more than a minute, minute and a half at the most. As soon as you fill out that survey, it gets sent to TDSC. They will then send out the CE. That, we had 600 people registered, so it can still take a week or so to get that. But we're going to do our best to get those out in a quick manner. So one of the reasons we love working with TDSC and Denmat and companies like that is that they always offer some special pricing. So you see on the slide there's a code for more Denmat at TDSC. So when you spend $250 with TDSC, you're going to get 10% off of any Denmat products in your cart. Double that. So if you go up to 500, then you'll get 15%. That's just for the Denmat products, not the TDSC products. And I know it can be a little bit confusing, but the offer is good for about 10 days, but it'll be automatic when you actually go onto a cart. It'll just do that for you. So with that out of the way, let's get into some questions here. When you're using the Jerry Store, do you bevel the enamel?
I do. Yes, I do. So the reason for that is because we want to make sure that the bonding has the most surface possible. So we do bevel it, and it also helps with aesthetics.
If you're trying to get more surface area, are you also using some type of bonding agent under the Jerry Store?
We do. Yeah, we etch, bond, and Jerry Store.
Okay. Do you trim the resin with a diamond or with a multi-fluted carbide?
I like using multi-flute carbide. Yeah, it just gives you a nicer shine, and then at the end of that, we just finish polishing, and we just make it really simple. We use the brownies and the greenies to polish, and a little bit of diamond polish sometimes, and that's it, a little bit of pumice.
Okay. I think there was a case that you showed towards the end where you had something wrapped around your wedge. Do you remember what that was?
It's a little bit of Teflon. So sometimes when we have really deep margins like that, when we have really deep margins, it tends to be a little bit more separated. So the wedge itself, even though this is the largest wedge, it's not going to be enough. So if you just wrap a little bit of Teflon, it makes it a little bit wider and easier for us to close that gap.
Okay. What's the comparison of compression strength of the Jerry Store, say, compared to like the Denton or traditional composites?
It's going to be really close to Denton. Composite, it's going to be a lot harder. Composite will be harder. So the great thing about it though is that you're using it really for times when you're close to the gingiva. So if you're talking about these class 5s, you don't have all this necessity to have a really hard material, but it will stand really well. And it has a lot of flexural strength too. That means that it's not just going to pop off right when you have those occlusal forces engaging with it.
Okay. How do some of the other products like Jerry Store, like Keytac Nano, whatever, how are they similar as far as biocompatibility or radio opacity?
Radio opacity, it's going to be the same as a composite. They do make it radio opaque because we want to be able to detect it under the with an X-ray. When we're talking about biocompatibility, Jerry Store is a glass ionomer. So we know that it's biocompatible because it's a glass ionomer. Glass ionomers tend to be very biocompatible, but we also want the strength of that resin, so that's why it's reinforced with composite with resin.
Okay. Did you just use the Jerry Store when you were re-cementing the bridge, or do you also use cement?
No, just Jerry Store. So sometimes when you use cement, you can either bond crowns or cement crowns. If you cement them, usually we're using something like Fuji, but in this case, like it's a glass ionomer, right? It's a resin reinforced glass ionomer. So you actually are having the best thing of both worlds. You're using a glass ionomer, but you're also using a resin cement. So it does both. You don't need to use anything else. I did on the crown, since it was a metal crown, I did clean it up really well, and then I put a little bit of zirconia prime. So zirconia prime is actually something that I use for all my zirconia crowns, but I also use them whenever I'm re-cementing metal crowns because it has the MDP and it helps a lot with the bonding.
Okay. For some of these deep preparations, are you using stuff like biodentine or Theracal or anything like that?
No, no, no. I used to use Theracal or BioCap or Limelight. We used to use those a lot. We found that whenever we're restoring with Jerry Store, it is extremely biocompatible and also has that fluoride release. So it tends to act really well. So that's we're actually avoiding using Theracal or Limelight or any of these other BioCap, any of these other pulp cap materials.
Okay.
That's
When
not to say
you
that
are
you can't use
using,
them, still compatible with
go
them.
ahead.
So if you feel more comfortable using them, Jerry Store is still completely biocompatible with them. So you can go ahead and use them too.
Okay. When you're using the tip on the soft tissue, are you actually touching the tip to the gingiva, or is it just like really really close?
Yes, no, you have to touch it. You have to touch it. It will not cut anything that's not touching. You have to have physical contact.
Okay. The case you showed with the crown with the deep margins, did you restore and cement the crown using the Jerry Store at the same time?
I did. It was all done at once because we want to make sure that those margins stay completely intact. So if we restored first, then we were going to be having to guess how to crown prep, and it was not going to work out. So we restored and cemented at the same time, and then we just removed the excess Jerry Store with multi-fluided carbide burr.
Okay. Um, so you had mentioned that you've used line light in the past. So does the Jerry Store actually replace that, like a baser or liner, like something like a line light?
You can use it as a replacement, yeah. So if you remember, when we were at dental school, we used to just use like hydrogen, Theracal or really Limelight every once in a while, but Theracal was the main go-to. But the great thing about Jerry Store is that since it has this fluoride too, it doesn't irritate that pulp, so it does a great job at that.
Okay, maybe when you were in dental school, I was using rubber base in dental school for my impressions. So that tells you how far back it goes. Um, what diamond
Maybe
paste do you like?
diamond. So Denman has this diamond polishing paste. That's just the one that I use.
Okay.
It's really fine, so it gives you a nice shine, and I love it.
Yeah, they got good stuff. So if bonding agents are used before placement of the Jerry Store, would that not block the fluoride from the Jerry Store from reaching the tooth?
It doesn't, so it will still penetrate. And the bond that I use actually has fluoride as well. So I use what is it called? Uh, Tenure Quick. So Tenure Quick is a bond that actually has fluoride too. So it will work. Yeah, that is actually a really good question.
Okay. Well, speaking about questions, we are through the list and we're right at the top of the hour, exactly where we wanted to be. So, anything you'd like to say before we call it a night?
Well, I just want to thank everyone, and hopefully we're able to see each other maybe at a convention or at an event or a live course later on. And just thank you everyone for joining. Again, if you guys have any questions, feel free to reach out, and see you guys soon.
Actually, we got a couple more if you have a couple more minutes. I don't want to
Sure.
let these ones go by the wayside. The Jerry Store, does that expand so that it's a problem when using, say, a porcelain crown?
It doesn't expand.
Yeah,
Was the
does it
question,
expand? I guess like as it's
it
hardening, or
it doesn't. So it's a dual cure. And by it being a dual cure, it's not going to expand or contract as much as if you were using composite and then polymerizing it. So no, it tends to hold really well.
okay. And could you just repeat the name of the bonding agent that you use that has fluoride in it?
Sure, it's called Tenure Quick, Tenure, Quick.
Perfect. Well, as always, I want to thank you for sharing your expertise with us. Whenever you're on the list for speaking, I know we're going to get a great turnout. And as I mentioned at the top of the hour, we had a little over 600 people that were registered, and we know your time is valuable. And as always, we thank you for joining us. And I don't think we have any more scheduled for this year, but hopefully we're going to see a lot of you in 2024. I wanted to remind everybody, again, if you had maybe come on a little bit late or didn't hear this about 10, 15 minutes ago, the webinar was recorded. That recording should go out in the next few days. The CE, in order to get the CE, you have to, number one, be listening to this live. If you're hearing this recorded, then unfortunately we have no way of tracking that. Secondarily, you have to have been here for most of the webinar, at least like 60, 70% of the webinar to get the CE. And the way that you get it is that an email will go out in the next hour, actually in about exactly an hour. It will have a link to a survey. Go ahead and just fill out that survey. It takes maybe a minute, 2 minutes at the most. It goes off to TDSC and DenMat. They will get the CE out. That can take a week or so. If you don't have it, say by next Wednesday, by all means, feel free to give me a shout and I'll follow up for you. So I want to thank TDSC for their sponsorship of the webinar. As many of you may know, they work very closely with DenMat. That's what you can see on the slide here. And that's kind of the deal that you get, that if you are spending $250 with TDSC, you're going to get 10% off of anything else that's in your cart that's a DenMat product. If you're spending $500 with TDSC, then you get 15% of any of the DenMat products that are in your cart. So it really makes sense to combine them together, bundle them up, because you're definitely going to get more savings at that time. We thank them, of course, for their sponsorship, because we can't do these webinars without these companies that are bringing in the speakers and making sure that we have great content. Finally, I want to thank all of you. We always get great turnouts for these webinars. We average every 2 to 3 weeks a webinar. I know that, in my mind, people are enjoying them because we're getting great turnouts all the time and we're getting good feedback. If you have other suggestions for content that you'd like to see for future webinars, by all means, shoot me a line. I'd be more than happy to bring that up with TDSC and DenMat and Brasler and CCI and all the sponsors we have out there, because I know many of them would love to find something that you all are interested in. Please stay safe and healthy out there, and we look forward to seeing all of you on our next webinar. Good night, everyone.